Welcome to One Interview, One World. This is Lainey Kay, and this is a show about interviewing people from all walks of life because everyone has a story to share and we can all learn from each other. I hope you enjoy listening. Today, I am with Dr. Julie Miller, who runs the Naturopathic Center for Wellness since 2003 in Laguna Hills, California. Dr. Julie is going to share with us about herself. She has many degrees and a lot of experience. And so I'm really looking forward to learning more about what you do and your experience. So why don't you tell us about yourself, Dr. Julie?
Hi, I am Dr. Julie, and I received my RN in 1979 with a BSN in 1981. And then I practiced nursing for all of those years in hospital nursing. And I also had the opportunity to work for a pharmaceutical company as the first nurse that they hired to call on doctors. So I have a very pure vision of how the pharmaceutical industry works. And in 2006, I went to an online program called Clayton, which was a 3-year Doctor of Naturopathy degree that I earned. And I opened up my own practice in 2003 right out of my home. In 2009, I became a registered naturopathic diplomat. I was awarded that. And in 2015, I completed a program from International Foundation of Wellness and Health as a certified nutritionist. So I'm also a member of the PMA. I was awarded a Doctor of Pastoral Science in 2015. So I have quite a varied background, and I also am a cranial sacral therapy practitioner since 2003, an advanced practitioner. So what got me into naturopathy? Going from nursing to naturopathy is a big jump. I had no idea what naturopathy was. I didn't know what it meant, what it looked like. And I was in a yoga studio one day and I found this, but there's a backstory. As a nurse in labor and delivery, I was recovering a patient that came through the ER with active herpes. She was 18 years old, and she had developed herpes blisters from intervaginal all the way down and on either side of her thighs. She was admitted to the ER, 18 years old, and it had been her 4th pregnancy. So I was asked to recover her as well as my other patients, and so I was asked to stay on for an added hours. Extended hours. I had a low-grade fever, and so because we're short-staffed, I had to stay on. So I then went home. It was like about 4 o'clock in the morning, and then I went to bed. I woke up at 8, and my oldest daughter, who was 3 at the time, came in because my husband had gone to work, and I sat up, and she looked at my left side of my throat and said, "Mommy, I can't see your throat." And so I went to look in the mirror, and sure enough, there was a problem. So I knew that my glands were swollen, but this was unusual. So I put her in the car. We went over to my friend who was a medical doctor and a DO at the time, because they didn't have DOs and MDs equal at the time. So this was 1985. And so he gave me 2 big shots of penicillin, which are very thick and syrupy, and they did nothing. And then I went down to my ear, nose, throat friend, and he took one look at inside of my throat and walked me over to the hospital, and I was thrown in the hospital. And I was put on over 7 IVs. They had no idea what was wrong with me. And so once the culture was taken, and I told my primary exactly what was going on, he said, "Oh my God, you're right." So I had systemic herpes. We don't know how, other than I had a low-grade fever, and it traveled all the way through. And the beginning stages was in my throat where all that edema took place. And it took 2 weeks to bring that down. And of course, I developed yeast because I had every kind of antifungal, antibacterial, antiviral, you name it, I had it. And so by the time I was released, I could hardly eat anything because I was so full of yeast, candida, everything that I had received. So a year goes by and I get pregnant with my second one, and I'm going into labor with her, and all of a sudden I'm having preterm labor at about 8.5 months. And so my OB at the time, we all worked together. So we're all friends. And he said, I'm just going to put you on something and then you're not going to work. So then I was put to bed and put on terbutaline as the drug to stop contractions. I delivered her early. And then, as a matter of fact, I was the first nurse to deliver her own baby at St. Joseph's Hospital in Orange. It was it was awesome. The OB was there, and I was sitting up, and all my friends that were nurses in the room, my husband, and I delivered her number 2 daughter. And number 3 daughter came 2 years later, only this time I'm going into early contractions, 6.5 to 8 weeks early. So again, I'm put in bed on terbutaline, and then I deliver. She's premature because I couldn't hold her until the full term. So she was born at about 5 pounds, and it was quite an event and quite an experience. And that is not grossly premature, I understand, but it was still early.
Yeah.
And she was 5.5 weeks early. And then my last one, at 4 months pregnant, I was 4 centimeters dilated. And at that point, put in bed on a terbutaline pump. And for the next 6 months, that's where I landed. And I delivered her on time because I couldn't do anything. And I had 3 other children. So I had a tremendous support team, tremendous help.
Mm-hmm.
So from there, 5 years goes by and I'm having other symptoms. My thyroid is acting out. I'm having endocrine dysfunctions of every sort you can think of. The yeast is still alive and well, and my abdominal area is not good. So now I'm having stomach issues, nausea, everything I ate. And now we're at 8 years goes by. And I had a friend who said, I want you to go see my friend who's a chiropractor nutritionist. And I said, oh, a quack. So I went, and he worked with me for 5 years. And in the beginning, I raised hell, to be honest. I was, I'm an RN, you don't da 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 da. And his wife, he was married to an RN, so that shut me up.
Okay.
So I did everything he told me to do, every supplement he told me to take, and we resolved the herpes and the yeast. I have no herpes in my body as of to this day. The thyroid has been me. I have reversed that. I had Hashimoto.
Uh-huh.
So what transpired from there was, at the end of 5 years, he said I was too smart and I needed to go to school. And that's where I wound up at Clayton College.
Mm-hmm.
So that's how the backstory is and how I came to be known as a naturopath. My education has really helped me a lot. The true reason that people come to see me, I've never advertised, is because of being an RN who is working alternative. And the reason I was awarded a diplomat in 2009 is because the state of California came after me trying to put me in jail. And they hired federal officers, and they went to my RN board, and they were saying that I was not allowed to use the initials ND. I have a doctorate of naturopathy, but in the state of California, if you do not graduate from their school, you are not allowed to use those two initials. Those are what are called naturopathic medical doctors. We are alternative naturopaths. We practice naturopathy. So that will take me into what is a naturopath.
Yeah.
We are non-invasive. We are a non-invasive system of healthcare which emphasizes lifestyle changes and the use of several modalities and alternative natural substances to indirectly help the body to heal itself without the utilization of drugs or surgery. That is what we do. So we can complement an MD or any primary care physician and complement whatever pharmaceuticals the patient is taking. We go right alongside of it with support that we do. And I use homeopathy, whole food nutrition, nutraceutical. So those are the modalities that I do use. And I also use cranial sacral therapy.
Mm-hmm.
So I'm treating the whole self. In naturopathy, we treat the whole self. So I started in my home, and I was living in a home where we were gated at the time, and so they were getting quite frustrated having the people keep coming to the gate. So I grew quite large, and within the first year, I was invited to join a 2-doctor team. One was an Oriental doctor of acupuncture, and the other one was a chiropractor. So I worked with them for a couple of years, and I grew out of that and then opened up my own. And my oldest daughter started with me, who is a nutritionist in Newport and has her own practice. And then we grew from there, and I went into practice with another chiropractor who wanted to learn from my medical background as well as alternative background. And I wanted to learn what he did. And so we joined and formulated a clinic. And we were in Crown Valley and Mission Viejo. So we worked together for about 5 years, and then we separated because I wanted to go back out on my own, and it just served its purpose. So I did, and where I am in Laguna Hills now, I've been ever since. And each one of my daughters, by the way, has trained underneath me, all 4. And I have 4 daughters, and all 4 of them are involved in some sort of nutrition or chiropractor, naturopathy. And my 3rd daughter works with me, and she's a traditional naturopath. She just graduated from school.
Oh, that's
So
wonderful.
it's quite an honor.
Yeah.
To be the start of all of it. And they're all very well educated and doing extremely well on their own. And my daughter that works with me does see patients on her own and does all of our nutrition counsel.
Can I ask you, so the difference between you became a doctor of naturopathy, but you didn't do it through the state of California?
Correct. So I am certified through the state of California because I'm a member of the California Naturopathic Board and Association. So, and I'll give you a little background on that. So I cannot call myself a naturopathic doctor by law in the state of California. Now, there are several other states I can, but I do have a doctorate of naturopathy, and I'm allowed to say that. So
Okay.
I do have that. So my doctor comes from the pastoral background, the pastoral science and medicine that I have a license with from the Pastoral Medical Association. That's how I can call myself a doctor.
I have a couple more questions. So if you're a naturopathic doctor in the state of California,
Yes.
the only difference is that you're licensed with the state of California, and then I would assume that means you can write prescription.
Correct. They
Okay.
are a naturopathic medical doctor. They are allowed to write prescriptions, and they do invasive treatments. That would mean drugs and prescribing some drugs and doing IV therapy.
Okay, that's the only difference. Okay, that's good to know.
Yeah. So with us, even though I do have the medical background where I did those things, I chose not to go that route because I already see on the other side what that does.
Mm-hmm.
So I'm not saying that it's all wrong. It's just that when we're talking about longevity of care, we need to get to the root of the problem.
Right.
So the one last thing that I will bring in, that the California Naturopathic Association, of what I'm on the board with, has been successful in keeping the practice of naturopathy separate from naturopathic medicine in the Naturopathic Doctors Act, AB 2685, signed by the governor this year. We just finished getting this accomplished. So this is a real big feat for us. And not only naturopaths, but anybody else, homeopaths, Ayurvedic medicine, anybody who is practicing in alternative medicine, nutritionists. In 2016, I was able to go to San Francisco and meet with Senator Jerry Hill. And we were able to have a sit-down meeting with him. And this is where he added the provisions in the Naturopathic Medical Doctors Act for us to be allowed to be called naturopaths, because we were to be educated and trained to practice safely. And we have done that. So you can now become certified through the California Naturopathic Certification Board. So that is an option for naturopaths that go to school. And we are in the process of obtaining 2 schools. Right now, we're looking at legalizing 2 schools so that we have those online schools. And then there are 2 of us that do the, what's the word I want? Your skills assessment. So, because you have to be watched in order to practice naturopathy. So
is naturopathy different than naturopathic?
Yes, and naturopathic medicine.
Okay.
Naturopathy is what I described, the non-invasive health system. Naturopathic medicine is more invasive. It's more allopathic.
Okay. So by you being on the board for naturopathy, which is different than naturopathic doctor.
Naturopathic medicine.
Medicine.
Mm-hmm.
Okay.
Mm-hmm.
That means that you kind of have permission then to do what you're doing, I guess.
We are allowed to practice as traditional naturopath, naturopath, and naturopathic practitioners. Those are our 3 titles.
Okay.
Our goals and where we're going with this, because we do have a lobbyist, mm-hmm. we are going to establish our own bill, which they've done in Idaho, mm-hmm. which will allow us to be registered and licensed under naturopathy as alternative practitioners.
Okay.
So that will separate us completely. So neither of us will go in each other's lanes.
Okay. And the bill that passed.
Yes.
Explain that just a little bit more.
Yes. The recent bill this year, 2022, which we've been working on for the past 4 months, we were able to keep the practice of naturopathy separate from naturopathic medicine in the Naturopathic Doctors Act.
Okay.
So we are in that bill, AB 2685. That's the bill. So being that we are commingled in that bill, we have to abide by what our part is in that bill. So we knew that it was coming up for expiration this year. So we wanted to make sure to have a lobbyist represent us so that there would be no more problems, because they could have come after all of us.
And then said you can't practice.
Any of us, alternative medicine.
Oh, like anything like homeopathy. And what about a chiropractor? Is that?
No, because they take insurance. So they are recognized by allopathy as well as acupuncturists. They take insurance.
I see.
That's how they get recognized. No, they do not prescribe medications, but they are allowed to take insurance.
Yeah. But
it's a very.
You guys aren't able to.
No, and we don't want to.
Okay.
So we do take health savings account,
mm-hmm.
any kind of HSA or the same similar initials that are in HSA. We do take that. And that is where the patient pays into that program, and they can.
That's positive.
Very positive. And we have a lot of patients that do that.
Uh-huh. Okay. And then do you do homeopathy too?
Yes, as well. Mm-hmm.
Okay. And that's something that you study when you become.
When you are in school, yes. We have several modalities we study. I do a little bit of iridology, very basic. There are some naturopaths that do more invasive iridology. That is one of their main modalities. In my program, that wasn't a major modality. Naturopathy was, which it really aligned with where I was as a nurse. And it also was a degree that was allowed by all of us who were either doctors, nurses that had already had bachelor's or doctorates in other areas. So that's why I did it.
Okay. And tell me, how long does it take, and a little bit about becoming that to study?
Okay. Okay, so if somebody were wanting to study to be a traditional naturopath in the state of California currently, they would have 2 years of education, and the schools, the board would provide. So when the school has to be qualified, so we have two that are upcoming. We're right in the process of reviewing. And so they would go to 2 years of that, or there is a college, Trinity, out of Indiana, that is an online program, and they have to do their practicum with either. There are two of us that do practicum in the state of California. So if they go online out of state, that's fine, but they have to do their practicum.
That
So
means in-person learning with
yes, that's 500 hours of in-person learning and even and hands-on. So they will learn the modalities between two of us because we do different modalities. It can be about 2.5 years for a traditional naturopath. So that's what we have so far. And then they become certified through the state of California by taking an exam. And we proctor that exam, and then they obtain a certificate and are certified naturopaths in the state of California through California education.
And then the way that you treat a person in this is you're trying to get to the root of what is causing the problem.
Yeah. So you may come into me and say, well, I have diabetes and I've been dealing with this for years. Or you may say, I have heart problems. I have thyroid problems. I have Hashimoto, whatever the modality is or the disease entity that you have been diagnosed with. So our basis is, well, let's get to the root of what you're talking about. This is a health challenge. So let's treat it as that, and let's see what's going on. So they said, well, what do I do with my meds? And we said, well, we didn't write those prescriptions. So that is according to what you and your doctor decide. And we will work right alongside of what you're doing. And that's how that starts. So then we start with the first exam, and they come in and see us. And would you like to know the hours on exam and how they do that?
Yeah, I think that would be helpful for people.
Okay, so it's an 1.5-hour exam, your first visit. And what I do is we have a tech that does a biomeridian instrument. And all of this is on my website. The biomeridian instrument tests the organ systems utilizing the tips of the fingers and the toes, which match the entire organ system in the body. So we get a graph reading on what's going on in the inside, which can be shocking because people come in and they think, well, I'm eating good. I'm doing alternative herbs and all this. I get it online and da-da-da. And then they're very, very frustrated when they see it's not working. So we work with whatever system is, we measure by red zone, yellow zone, green zone. The red zone is highly inflammatory. It's been going on for 2 months to we don't know how long. And then the yellow zone is chronic inflammation. And the green zone is where we want to be, in the first green zone. Because then it starts with inflammation. And you're hearing a lot about that today. Inflammation, microbiome, you're hearing all these words. And these are things that we are working with. So as alternative practitioners, we study, we go to classes, we learn about this constantly. So then you're going to do that exam, and then you're going to come and have a hand-on exam where I am poking different points to see what things are making you feel uncomfortable. And before I even do that, because I'm a nurse, I do the blood pressure, the heart sounds, the breath sounds. And then I look into the eyes, as I said, with a scope, and I do a basic iridology. And then I look in the ears and the nose and the mouth. And I'm looking for several different disease pathways. So the mouth is your biggest carrier. So I'm looking for several fillings, amalgams we call them, or I'm looking for yeast, candida, anything that I can find in the mouth. Poor digestion, proteins, and that's how that runs. And then when I'm finished with that, I do a modality called applied kinesiology. So I went to school to learn how, we call it in simple language, muscle testing. and I use the right arm in a very light pulse. And so then I will test the entire system, utilizing the points on the body and the organ system to actually see. And everything will match. That's the whole point. So I do the biomeridian, I do the hands-on poking on points, and taking blood pressures and the various things I mentioned. And then when I get to the final kinesthetic part of it, it all comes together so I know exactly where we need to start. So then I get a root. And then we start with the root, whether we need to vacate the root, what's causing the root not to work, to vacate the substances that are antagonizers, and then we move from there. And 99% of the time, the first visit, the person is going to find that they're going to have 4 different stressors that could be their accusers, meaning that they are causing the homeostasis to be out of balance, homeostasis, as well as the microbiome not to be functioning correctly. And those are the things that we need to fix so that the others can work. And then the disease process slowly abates as they're under treatment. So you can expect within the first 3 months to see changes. No, we don't put you on a cleanse when you first come in here. That word is very misused. We want to first find out what the problem is. And we need to start there. So the body's like an onion layer. We start with the outside, and then we go inward.
Do you do blood work as well?
Yes. And once we've resolved the stressors, which could be parasites, yeast, it could be metals, chemicals, whatever viral, whatever stressors are causing a problem, those 5 are the big ones. So when we resolve those stressors, that's the time that I do an in-house urine. And then we also do a finger stick to see what the glucose, the A1C, which is a 3-month reading of what the glucose is actually doing. And then we do a complete lipid panel with that. And I have a tiny little cardio monitor that I use. And then when that's read, then I will get a comprehensive, and I order that through a lab called Vibrant Labs. And they come to your home, draw the blood for you, and then I get over 200 tests. And it's a complete comprehensive. And then I do a functional blood study on your blood work. And your urine I do in-house. And I do a functional study on that right in front of you. And the same with the lipid and the glucose. The first thing that I do once you've resolved the stressors, I do that right in-house. So you get an idea of what these numbers are, and then we go from there. And I don't like to focus so much on numbers, but because I have that background, I want the whole thing. I don't want just this piece, that piece, and this piece. It's not going to work. And also being a patient myself. The beauty is I was a patient first for 5 years. So I know what it takes to be a practitioner.
Yeah, how to change everything.
Yes. And as a nurse, chronic bronchitis and asthma as a kid. So I knew what it was like to be in a doctor's office all the time. And so nursing, it was right up my alley because I wanted to help others so they wouldn't walk through this. So now as a naturopath, it is so rewarding to be on the alternative side, because even though I still respect my allopathic side and I respect other allopaths, there are good ones out there. It's just what's going on in the system today, especially since COVID, it is overwhelming to those of us in alternative medicine. We are being bombarded, which is really wonderful. And at the same time, what is happening with our system? That's what the question is. What is happening with our system? And I can tell you, people are educating themselves. They are no longer in the dark saying, well, my doctor said this. They're not there anymore. So the internet has been a blessing in that sense, because they are getting educated. But the thing that's The difficult part is the misinformation that they're given also. So there's two sides to everything. And I just really love practicing root medicine because it's not about how great you are, it's how wonderful the body can make its own change.
Yeah.
And we get to be on the ground floor of identifying that, which is so awesome. And the patient gets to smile. I would like to share with you one patient that came in to see me, and he is an engineer, phenomenal human being, and his body was wasting away in front of him. He has done everything medically possible. He does have a diagnosis, and to preserve him, I'm not going to give you any of that. I'm just going to tell you what we have witnessed. And he came in desperate. I couldn't even examine him on the first visit. I had to do everything from a wheelchair.
Wow.
He was so bad. And his wife just looked at me and said, help. He was a referral, as I see the family, and he had no idea what alternative medicine was. And he was not a believer. But he said, I'm willing to take a chance. So I started with basic, and I started incorporating in cranial sacral therapy right away. And then the second visit, a couple of weeks later, there was improvement. I could get him on my table. And then I started supporting him with supplementation. By, I want to say 5 weeks, he was driving himself. Oh, and by the way, he had such bad edema, which is swelling from the ankles down through the feet. It was so bad. He couldn't walk. His edema was at 50% less. Walked in, drove himself to the appointment, and I started crying. I could not believe my eyes. And he just looked at me. He said, I've been walking at home. He works out of his home as an engineer. And so 2 months go by. He's driving his kids to school. He's gained 10 pounds total, and he's still gaining because he was emaciated. And he cannot believe the change. He takes anything we give him, and his body moves so wonderful in cranial sacral therapy that he is able to receive the blended modalities, and his body is healing because his head's out of the way.
That's beautiful.
Yes, it has nothing to do with me. I get to be the vessel to help him to heal.
It makes you, yeah.
Yes.
It touches
because
you. Yeah.
This isn't the first time. My very first patient was a cancer patient brought into me by his family, 19 years old, end-stage cancer with 2 weeks to live.
Oh my gosh.
Again, I looked at him, and his biomeridian was the worst I'd ever seen. The results. I had all the blood work in front of me. I already knew. And I just looked at him, I looked at the family, and I said, this is a major life transition. I'm going to be a Nazi, and you're not going to like me. But you are fighting for your life. And I want you to know he got married. He was able to put sperm away. We got 4 years of pure life out of this kid. And he started to get cocky, meaning, I'm okay. I don't need to do much of this anymore. And it started to transition down the road. He went back to chemotherapy, and I was at his bedside. And he said to me, you know what? Chemotherapy didn't help me. What you did help me, and I made poor choices in the end. However, if you decide to quit, I will haunt you in your testing arm. Now, hang on. So at that time, I just was, okay. And I went to his bedside, and I was there as he was dying. So this little guy, I have his picture in my office to this day. And his wife remarried, has children of her own. She's doing great. And It really ripped me up, but I knew that I was where I was supposed to be. And there was a day we moved into our office that I'm in now 7 years ago, and we got everything settled. And I looked at my employees and I said, I don't know if I can do this anymore. And so the next patient was coming in and I started testing the patient. I couldn't move my testing arm. And I went, no way. And my daughter went with me to his funeral, and also had my third daughter who's in practice with me. And she goes, told you so, Mom. He meant it. And I said, oh my gosh. And I had ache in my arm all day long. I could hardly move that arm. And I just said, okay, I get it. I get it. And I just let go of that thought and just said, that's the end. And God just keeps bringing me more and more and more.
That's really fantastic.
And these people are really sick to, maybe they just want a lifestyle change, or maybe they just don't even know what they want. They just know that they're not getting what they need.
Mm-hmm. Yeah.
And that's okay, because that's why we're there.
Yeah. I think in the future, it will become more. So
Definitely.
you're talking about it because it helps educate people that
yes,
the answer isn't a pill.
And the other thing is, the new wave of patient is this. They are no longer just listening to you and you have to talk simple language. Oh, no. I'm talking full language to them that goes over their head sometimes, but they understand me. Okay. And that's because they're researching. And I want to educate them at that level. Mm-hmm. I don't want to undermine what they're learning and what they know, because it's all out there. Everybody's talking about it. Everybody's on the computer. They're talking about it with their friends at work. So I want to teach to those, if that's where they are, I want to meet them there. If they come to me and they don't know a thing, I want to meet them there. So we're about listening and hearing the patient.
Yeah, that's big.
Yes, because their biggest complaint is nobody's listening to me. Right. They're big to charge me and to put me on all these different things, but nobody's listening or hearing me.
Mm-hmm. Would you say that a big part of somebody changing their health has to do with their eating?
Yes. The emotions are also driven. However, it's what we are putting in our mouths. And today we all know our resource of food is not at the height. Even our organic places, we have got to take back control to what we are doing to our bodies. The bodies have remained the same. The cellular structure is the same. The amount of cells that we have in the body is not changing. The cells every 30 to 32 days change. So we need to address that. What we put in our mouths, how we put in our mouths is vital, but it's not the only answer.
Right. It's a lot of things like exercise and
our lifestyle, the emotions, what's going on at home, what's going on in your job. It is amazing to me how much I don't have to ask questions, but just listen. When they first come in and they fill out their intake form, it's long. And I'm sure they're rolling their eyes, but they fill out every word. And when I sit down with them, I go over every page, every detail, which allows me to find out even more.
That's really good, because I remember one time someone asked me to fill out and I gave like a lot of information and she never went over it. And I don't even think she really read it. And it's like, why did I do this?
Well, why did I waste my time?
Yeah.
Yeah. And when I'm bringing up right in front of them, so it says here that you drink this many sodas a day. But I didn't go back to the paper. I said, it said there in there that that's what you do. And you drink 2 large cups of coffee a day and you need it to stay awake. Or or that you're vaping, doing this, whatever it is. They said, oh my gosh, she's listening. And then I get full eye contact. It's important for me to get full eye contact, and I give them full eye contact. They remove all their watches, rings, everything. I don't want any of that.
It's really good.
Yeah. And they sit close to me. I have them right on my table, right close to me. And I'm sitting on a stool. I do not want to be above them. I like them on the table being a little bit higher, so I'm below, so they don't feel threatened. I'm not there to threaten. And if they are, yes. And if they're uncomfortable with me doing the conventional things that I do as a nurse, that's okay. I may say to them, then maybe we'll do it at the end, or maybe we'll do it later. Or if you're really uncomfortable, we'll not deal with this today.
Mm-hmm.
You let me know when. And I've had a couple of patients like that, and they'll say, okay, Dr. J, I'm ready. Let's test me.
Mm-hmm. Yeah, because they're not comfortable with some of the alternative yet.
And maybe they've been physically assaulted or abused.
Yeah.
You know, and I have to be really tender to that and be very much a listener.
Mm-hmm.
So I am not going to be, okay, let's go. And the same thing when I'm starting to muscle test, it's foreign. Not everybody knows what that is.
Why don't you explain? Because
okay.
I'm kind of aware, but I think a lot of people don't know.
So what we do, I use the right arm, and it's a pulsing. And what we're testing is this. Think of this. You have a fever. When you have a fever, I ask them, what happens? Well, temperature goes up, you sweat. What else can happen? Nausea, diarrhea, vomiting. All these physical things can happen, but they just happen. So when I'm testing you, I'm pulsing the particular organ system. And when you can't hold the resistance, all that means is the blood is rushing to that organ system to alarm your arm and my hand that something is not right. It's out of homeostasis. So how are we going to return that? And what is the cause? So that's my goal. I'm on a hunt. I'm looking for a cause. So the first visit, there's probably going to be a lot of organ systems that you're not going to be able to hold resistance for. That's okay. But as we go along, 5 weeks later, wow, all of a sudden, and they're smiling.
So are you putting pressure on that, yes, or are you asking questions?
No, I am actually touching with pressure, and the pressure is extremely light. Okay. It doesn't take anything to change the resistance.
Okay.
That's how I was taught.
Yeah. So it's kind of like they have their hand up or something, and you're
straight up, like a soldier. Like a soldier.
You feel the body part, and if it doesn't stay straight up, it kind of like falls or something.
It will, and the shift will not go way down. It'll be like that.
Okay.
Like that. It's so tiny. And they at times don't even know what's happening. And then I'll get the ones that are, they think they know it all, quote unquote. And I'll say, okay, go ahead. Let's go again. And we first have to open up the body so I can test it. So I do a measure of that first. So I go my hand over the belly button to see, okay, is this body open enough that I can do that? And I don't do that right away. I will first start with my hands at the feet, starting cranial sacral therapy to see what is the fluid, the cerebral spinal fluid doing in the body. That needs to be flowing from the brain to the dural tube all the way to the feet. And then it needs to be moving out. So that cerebral spinal fluid is the beginning of how we breathe, metabolize, how we rid waste, how we oxygenate breathing, etc. It's the entire body system, how our blood perfuses, etc.
Okay, and can you explain what cranial sacral is?
Therapy is, yes. So we are working with the dural tube, and we are working with the dural tube as a signal of rhythm patterns within the body. So, for example, if I start at the head, I'm looking for how the fluid is moving. So, in the brain, there are individual sutures in the brain, and that emits fluid, which is cerebral spinal fluid, at about 8 to 12 cycles a minute. Dr. John Upledger is the inventor of that. He was a DO as an osteopathic doctor. And he discovered this when working with patients. However, he was in an open craniotomy surgery with an assist, and he was holding the head, as the surgeon was operating, and he noticed the fluid seeping like a pulse beats. It's so many beats per minute. So he figured it in cycles. So when we're feeling and we're taught where to put the hands, we're looking at how many cycles. It's about 8 to 12 cycles. When you've never had it done, your cycles are probably much lower. And if they're really high, it would mean that there's a lot of sympathetic nervous system overload. So the whole idea is to bring, again, the body in homeostasis. So I use this to even before I touch the patient, because I want to make sure when I'm testing that I'm not in the way and they're not in the way. I want to be as professional and as profound as I can be in identifying the problem as they are trying to receive that. So I make sure that I use the different, we call them stations of the body, so that everything is patent or moving. Then I get to the top part of the head and I do what we call cranial pumping. And what that means is I'm pumping this CSF, the cerebral spinal fluid, down the turtle tube to move it out to the body. So I want to make sure that I'm getting that response and there's no blocks in the spine. So they may feel it at the bottom of their feet. They may feel it in their hands. They may feel it in different parts of the body, even down the spine as I'm doing it. It's very subtle.
Is it that your hands aren't touching them, but it's
they
are
touching?
Okay.
Mm-hmm. Yeah. And so it's all hands on. Everything I do is touching. Yes. And I start doing the muscle testing from there. Mm-hmm. Because the body is relaxed, the brain is relaxed, so there's nobody in the way, including me.
Makes sense.
Yeah. And the other thing I want to tell you in our practice, so once you see me, it's usually a 5-week wait after that. So we're booked out about a month and a half, which is really good because it used to be 2 and 3 months during COVID. So now it's about a month and a half. And I can handle that because I don't want to lose patients because they can't get in. And we bend over backwards. If we've got a missing space, we'll get you in. So my daughter follows me in a 5-week program, and she does all nutrition counsel and muscle test the patient 2 weeks after they've been on her program, which is nutrition and also exercise. And she gets into exactly what they're doing. And she is very kind. She goes step by step. So if they've got to come off certain substances, she's not saying, okay, you got to do that now. No, she's walking with each individual on what they are doing individually. She meets up with them by phone. And then 2 weeks later, she meets them in the office and does all the testing to see where they're at and to see if they've resolved some of the issues that they came into me for. Mm-hmm. And then we go from there. So they are completely aware of what's happening until they see me again. And that program is mandatory, and there's a charge for it. And it's a 5-week program that has been extremely beneficial in educating the patient. So now they know what to expect. And it cuts down on their visits in the long run. So then they'll come back and see me once every 3 weeks, once a month, maybe. And then they get down to once every 2 months. I try to not keep it out further than that because the body changes every 30 to 32 days. So we want to see, what is the body asking for? Mm-hmm. Mm-hmm. And go from there. Is it emotional or is it nutritional, or what do we need to support with? Mm-hmm. Meaning supplemental therapy. All my patients are on supplemental therapy.
Based off what organ or whatever they...
Right. And whatever we're trying to recover. And then we want to maintain homeostasis. We want to maintain the microbiome, keep that healthy so that there's no blocking of the macrophages, and then we got the T cells and the B cells. These are all our fighter cells. We don't want anything bothering the immune system. So we need those macrophages nice and strong. And the gut is the biggest culprit.
Very good. Okay, did you want to touch on the licensing and having issues with the state of California and explaining that?
Yeah, I can do that again. And so, in answer to your question about what's going on in the state, we, as I mentioned before, we are successful in maintaining the bill with the naturopathic medical doctors in that we can retain our titles. Our goal is to develop our own bill and our own registration and licensure under naturopathy. For now, this is the bill we're under and what we're allowed to do.
Mm-hmm.
Traditional naturopaths are not allowed to call themselves NDs in the state of California. That needs to be understood because there will be a penalty.
Okay.
And we will penalize first. Mm-hmm. So we're aware.
Mm-hmm.
We represent almost over 500 naturopaths in the state of California, traditionals. And we're having more and more since this bill passed. They just keep stepping up and saying, I want to be certified. Certify me. So we do have a certification board. You must be certified. We don't have that passed in the state of California yet, but that doesn't matter because this is part of education and training. So you must be certified in order to be a part of the California Naturopathic Association. And it's going to be mandatory down the road.
Mm-hmm. And what about in other states?
In other states, they have their own jurisdictions. Like I said, Idaho is we're mirroring Idaho right now. They finally got their own bill for naturopathy, and the naturopathic medicals are doing their thing, and the Board of Naturopathy is doing their thing. And so there's no more this intertwining and mix-up of who does what. Mm-hmm. Mm-hmm. There shouldn't be a mix-up. We're non-invasive. If you're calling my office and you're looking for an IV naturopath, I tell you, I don't do that here. However, this is what we do. And then they're calmed down and they're, oh, okay. That's good. I like that. So, and I'm sure in naturopathic medical doctors, they may be getting the same. I don't know. I can't speak for them, but I can only speak for here.
Yeah.
And being an RN as alternative, it's been very challenging. Very.
Mm-hmm. But you feel relief and
yes,
at things now.
And I feel very protected, and I love the fact that we're getting our own bill,
mm-hmm.
and we have a very strong board, very strong, and that's what's important. And it's important for all the naturopaths out there that are scared to come out. Mm-hmm. It's okay. You're safe. But we are governing. We're a governing body, and we have to abide by what the rules say in that bill. You have to be educated and trained. You can't just be going to a weekend school and call yourself a naturopath.
Right.
Just like cranial sacral therapy. You can't go to a weekend school and say, oh yeah, well, I'm a practitioner of cranial sacral therapy. No, you got to go through the modalities.
Mm-hmm.
You got to go through the schooling and know what you're doing.
Yeah.
And be evaluated. Yes. Yeah. So it's exciting for us. It's exciting for the public. And I'm a nurse, so I call them my patients because of being a nurse. It doesn't mean you're lesser than. It's just that's what you are. And I don't refer to them as clients because I'm a nurse and I have genuine, I'm heart to heart.
Yeah, that's beautiful. Can you compare germ theory to terrain theory?
So getting it from the environment, is that what you're, I'm
yeah,
trying
I feel like allopathic and or even in regards to like the COVID, or
Yes.
viruses,
Yeah.
they want you to think that you're gonna, because somebody else is sick, you're automatically gonna get sick.
Yeah.
But to me, the terrain theory is that it's your own body, it's your own immune system, and if you're well,
Yes.
you can fight it off, and you're not gonna get sick just because somebody else is sick.
You just said a mouthful. That is correct. You just because somebody is sick, they're sick. Now, I I don't have a lot to say with the vaccines, but I will say that I've seen a lot of side effects up to a year later, several. I will say that we have been sicker in the last year and a half in our office than we have ever been. So I do notice that those that have been vaccinated, they are really getting sick. Now, are all of them 100%? Not all, but a large percentage. So your immune system is a beautiful thing. You are made up of bacteria, trillions of cells. So your body has the ability to ward off or bring in what it wants to. And it has the ability to heal itself if you know what you're doing with it. I found 4 days.
Mm.
So viruses, bacteria, fungal, I find within 4 days, I'm starting to see a turnover in healing.
Mm-hmm.
As long as the food items are being removed and they're being compliant with lifestyle change.
Mm-hmm.
So there's a lot on this. There's a lot of controversies. Allopathy is more pro-vaccine and pro, let's prevent COVID. And in the alternative world, if you're a true naturopathy practitioner, you don't believe that phenomena. We believe that the body has the power to heal itself. We stand firm and strong because that's who we are, non-invasive therapy.
Mm-hmm.
So I have to just keep going back to that.
Right.
To the root.
What do you tell your patients to do when they feel run down, or they feel like they're going to get sick? Like, what are some of your recommendations?
Well, to be honest with you, I'm able to find it before they even know it.
Oh.
So when I'm saying, well, I'm noticing, because I'll look at a different point, and I also use vials, I'll have them hold the vials. So I put everything in threes. I want to get back up here. So, and because being a nurse, I like the science, and I want to make sure that this science is sound.
Mm-hmm.
So when I'm testing, and I find something, I'll say, something, I think it'd be a good idea if we put you on a little bit of, let's just say zinc and quercetin and vitamin C. And I may have that in one supplement with vitamin A. And I might say, why don't we do this a couple times a day because you're testing for it. And just as a preventative measure.
Mm-hmm.
And sure enough, I will get a text or a call the next day in the office. Well, she was right again. I started with the sore throat. So I say, okay, now we're going to do this and this and this. So the whole idea is to catch it before. And if my patients, I tell them, if you're really aware of what your body's doing, call in the office. I will fit you in. My sickies will go first. Sick patients get first. I will get you in and we will get you on something. And then you go home and you're going to rest. And that's the way it works. If they're out of state, then I tell them what to do out of state. And we go from there. Because go ahead. I see patients from all over.
Oh, okay. Yeah. So you do Zoom meetings or
not Zoom meetings. The old-fashioned way is telephone, and then I do use a surrogate when I'm testing, and that can be wahoo to some people. But I'll tell you, my patients that I see out of state, there has never been a wahoo. I've called it right on every single one, and I tell them, don't tell me what's going on. I'll figure it out, and I'll tell them. They'll go, oh my gosh, how did you know? And it's because I've been doing this since 2003, and I've been a nurse. So I do have an idea of how the body works. And a part of that, I've been gifted. So I can't give you 100%. How do I know everything? I study, I've taken exams, passed tests, have certificates, licenses. I've done everything that I have been asked to do. But there comes a time, the bottom line is intuition.
Mm-hmm.
And I have very good intuition and I'm gifted. And I realize that in where I am at now in my life, that it's okay to be gifted. It's okay to be different and to utilize it.
Yeah.
So that's what I do. And I'm not here to diagnose you. That's not my job. You can go to allopathy to be diagnosed because you come into me with your diagnoses.
Yeah.
I'm here to find out what's underneath all of that. The same with infertility. I do a lot of infertility where they've gone through several infertility methods. And it's like, well, if we just do this and this and this and this, you should have no problem. And they get pregnant. Many times I've called a pregnancy before they even knew.
Wow.
So I have a heart. I was labor and delivery nurse the last 10 years of nursing. So I have a true heart and have a heart for nurses. And I'm constantly asking nurses. As a matter of fact, right now, I'm in the beginning stages of developing a program after the first year where I want to hold clinics for nurses so that they can come and see what happens. And I will teach them so that they know they can either implement or that they can see that there's another way.
Yeah, that's very.
I already have 3 nurses that are like, I'm in. So I want to start out little. I don't want to make this a big ordeal because that's how I started out. I'm very quiet. And I like being that way. I'm not quiet in work, but I'm very quiet out in the public. I don't do these interviews. You're my very first interview. I don't do them. I've been asked several times. I've been asked to teach several times. No. I am about being there for you. You're my patient. You're who I care about. I don't care about all the fluff. Doesn't interest me.
Beautiful. Tell everybody how they can find out more information about you.
You can call in to our office. And I'm going to leave you with the number 949-273-6240. Kelly, my daughter, who's the traditional naturopath, she does all the screening and calls. And she will tell you exactly what's needed to happen for the first visit and how much you will spend. And she will tell you on how often you will be seeing me and how often you see her in the beginning. And she does all my nutrition counsel for every single patient. I will reiterate that. We used to make it a voluntary and I wasn't getting good compliance. So now it's mandatory.
That makes sense.
And you will get all the pricing right from her. Oh, she has no problem with any of that. That is not my strength. And then, and our numbers on our website is number and also the address of our building is www.naturocw.com is our website. And you can read all about us right there and everything that we do and also the testimonies. We are on Yelp and our patients do Yelp us. And I do have Wix. So you can also reach me through Wix, and I do get patients through there.
Okay. So regarding supplements, is that something that people buy directly through your office?
Yes. And I carry a whole library. And so everything is tested. And I don't just hand them out and say, take 2 of these and call it a day, and then I don't see you for months. No. You know, there are different kinds of us in this field too. So you have to be very selective in what you really want. If you want consistency, we're your choice. If you want to just take something fly by night and say, okay, I'm done, then I'm not the one for you. Because I'm looking at 100% lifestyle change and recovery. Because that's the way I came into this. So I want other people to grasp the benefits that I've had. And by the way, I reversed my own Hashimoto. All my Immune numbers are completely normal. And I don't even take any thyroid medicine to this day. Everything is alternative that I do.
That's really good.
Yeah.
What if somebody is very healthy and they just kind of want to do an annual with you?
I get that. I do get that. And when they come in, they tell me, oh, I'm doing this. I'm doing this. I'm so healthy. My prior naturopath, they had me on this, and I'm great. And they come in, and then we put them on the biomeridian, and they go, what happened? And then we just say, okay, maybe we're missing something here. You won't have to be going as long, like maybe as often. But to do once a year, you're not doing yourself the greatest. I don't even do that. I go every 2 to 3 months to my daughter. I'll either let her teach me or colleagues test me, not teach me, test me. I don't ever recommending go once a year. This isn't an allopathic doctor. You go once a year to get examined, to have your blood done, and then it's bye, see you next year. That is not what naturopathy is about.
And with naturopathy, is the meridian testing something that's done with, that's what you're taught?
That's what yes, when you are putting your fingers on the different meridians, a biomeridian, that's again a modality, or I'm sorry, you mean the testing, the biomeridian testing, is that what you're referring to? Yeah. When we are using the stylus to test those meridians, that is not every naturopath does that. They're very few, as a matter of fact. There's one other naturopath, which is the president of our association. He does it. And he uses a more modern version. I've had mine since 2005, but it works fabulous. And so I like it because of being a nurse. I don't want to keep drawing bloods or having you go have blood draws all the time, because it's not necessary. The blood changes also. You might have, not felt so good, or had a fight with somebody at home, or, any circumstance. And then you go get your blood drawn and things might be a little bit off. So the biomeridian is so accurate in that we just need you hydrated, and it just picks up where you are right at that moment. But it's testing what's going on 2 to 3 months behind.
Okay.
So his patients will say to me, well, I wasn't so good this week, and I know I'm due for that again, because I test about every 3 months. And I know I'm due again, but I did this and this and this. And I said, what are you worried about? Let's just see overall what's going on. And then they're surprised, pleasantly surprised. Oh, it didn't wreck me out that much. Yeah. So there's positives to this, and nobody's ever going to be perfect. We also have a PEMF mat that patients can lay on before a visit if they choose, or after, or they can come in at random. We'll sell packages of it. And that's wonderful. That is allowing, it's a pulse thing, and they're like little pulses going on from head to the feet. And you basically is working on the whole neurological system. So that's another neat thing we offer.
Okay. All right. Well, I like to ask people at the end, what do you feel humanity needs to work on to make our world a better place?
Oh, that's a loaded question. We need to work on respecting each other, smiling at each other, and being sensitive to each other, no matter where our walks are in life. And to be respectful, I go back to that, because we don't need to judge each other. And if you have somebody that doesn't choose alternative medicine and they're perfectly happy doing with what they're doing, so be it. And I work with families like that, and they basically wind up seeing me, but it's being able to be human with them. So I just say the most beautiful thing you can do is accept yourself where you are, and you are going to be a light to others. That's really the bottom line. And if you are not in a place where you are radiating God's light, that's okay too. But you're really going to be able to communicate with humanity and understand where they're coming from when you do have that.
Very Thank you. Thank you for taking the time to tell us
Oh,
about yourself.
you're welcome. Thanks, Lainey.
You're welcome.